Good afternoon, everyone. My name is Kathy Purdy. I'd like to welcome you to this week's coronavirus webinar presentation. Just two quick housekeeping items before we get started. Please enter your questions through the Q&A box located at the bottom of your screen, and we will do our best to address as many as we can throughout today's program. Once the webinar has ended, if you would take a moment to complete the survey, we would appreciate it. Your comments and suggestions for future topics are shared with our presenters. So I'm going to hand the program today over to Adam Masterleo to get us started.
Kathy, thank you so much. And thank you to everyone who is attending this afternoon. Thank you to our regular attendees, as well as those of you who might be joining us for the first time. We have a packed program today. The state has given us a lot to talk about in the past couple of weeks. So we're going to hit on a number of issues that are both timely and relevant to all of you, hopefully. We're going to start off this afternoon with a discussion of the recently released updated school guidance. And presenting on that this afternoon will be Candace Gomez. Candace is co-chair of our school law practice group and has been really at the forefront of these issues and has been advising clients for probably a year now on reopening and what to do with the pandemic. So Candace, thanks for joining us and take it away.
Great. Thank you so much for that introduction, Adam. Good afternoon to all of you. I hope that you are well. As Adam mentioned, we did get updated guidance from the New York State Department of Health just this past Friday, April 9th, that I would like to share some of the highlights from with you today. The guidance applies to all types of schools. So this includes public and private schools from the pre-K level all the way through 12th grade. It also includes BOCES programs, excuse me, and charter schools. Part of the reasoning for this guidance, as put forth by the state, was to ensure equity in education by beginning the process of bringing as many students back to in-person instruction as possible. The state has found that we have seen that certain populations of students have suffered more than others during this pandemic. And in order to try to make it more equitable and to improve the quality of learning for all of our students, the most ideal method would be to bring them back to in-person to the extent that we can. But I really want to key in on the fact that this will not happen immediately. And we're going to talk through some of the reasons why this is not going to be the overnight change that maybe some parents had anticipated. The guidance does not require schools to immediately return all students to in-person instruction because there are many safety factors that must still be considered. One of the biggest barriers to returning all students to in-person instruction throughout this pandemic has been what we call the 6-foot rule, which is the requirement that students be at least 6 feet apart from one another while at school. And many schools simply did not have adequate classroom space in order to accommodate that requirement, which made it necessary for those schools to educate students either in a fully remote model or through a hybrid model where only a select portion of the student body would be able to attend in person on some days while those other students stayed home. So that has been the model that many schools have been using throughout this pandemic. The updated guidance that was released on Friday reduces the physical distancing requirement from 6 feet to a minimum of 3 feet between students in classroom settings for some schools. And I want to really emphasize that that only applies to some schools. So yes, this is the reduction from 6 feet to 3 feet that we have been waiting for, but it doesn't apply equally across the board, and I'll explain why. Here's the catch. The CDC has developed different levels for community transmission of COVID-19, and a school is able to reduce physical distancing from 6 feet to 3 feet, depending on where that school falls, according to the different CDC levels. In counties with low and moderate risk of transition, those schools can adopt the 3-foot rule. So that's relatively straightforward. However, in counties with either a substantial risk of transmission or a high risk of transmission, there's a complicated series of steps involving cohorting, which must be considered. And cohorting is basically the grouping together of students whereby those students would remain as a group together throughout the school day. And as you can imagine, that's relatively easy to do on an elementary level where students typically are assigned to one main classroom teacher and spend the day with that group of students. But it's much more difficult to implement that on a middle school level or a high school level where students are changing between different classes and don't have one main classroom teacher. They have several teachers depending on the particular subject area. So that has been an impediment that has made it very difficult for many schools at this point to switch to that 3-foot model because they can't implement the cohorting structure. Another question which has been raised as a result of this guidance, which we're waiting for a more clear answer on, frankly, from the state, is how do schools decide where they fall on those CDC levels? So does a school independently decide that they consider themselves low risk or moderate risk? Does the local Department of Health decide that? Is this going to be a statewide decision? And we don't really have clear answers at this point as to who makes the determination as to what level a particular county or a particular school will fall on for the purposes of determining how much physical distance needs to be maintained between the students. So we'll certainly keep you posted on that. In terms of face masks, there have been questions in the past about whether or not all students must wear a face mask in the class, especially if, for example, a face shield was worn instead of a face mask. This guidance document seems to be pretty clear about the fact that a face mask must be worn at all times while in school, except during meal times, and that a face shield is not an acceptable substitute for a face mask. Physical barriers also are addressed in this guidance memo. There have been questions about whether a school can reduce the amount of physical distancing if they have those plastic barriers that are put up around students at their desks in order to reduce the transmission of COVID-19. And in anticipation of trying to bring back as many students as possible, many school districts have spent hundreds of thousands of dollars in some cases investing in those plastic shields so that after spring break, they could bring back a lot of those students. Unfortunately, this guidance document has kind of thrown a monkey wrench in that because it states that where physical distancing cannot be maintained, those physical barriers are not adequate to substitute for that. So in other words, it seems to us that the guidance is saying you can use a physical barrier, but that is not going to replace the physical distancing that you need to have between those students in the classroom. So clearly that is a source of angst and frustration for some of our schools. And we will see if there is updated guidance which perhaps will allow for those physical barriers as a substitute for physical distancing. But at this point, that does not appear to be the case. Transportation is also an issue raised in the guidance document because although they are encouraging schools to bring back as many students as possible, the state does not seem to have relaxed the physical distancing requirements for students on school buses. They are still recommending that students be placed on one child per row and skipping rows. In other words, having as few students on a school bus as possible in order to prevent the transmission, which, as you can imagine, is going to be a major hurdle for those parents who cannot drive their children to school. And it's going to be a major hurdle for districts who may be trying to bring back as many kids as possible, and they figured out the layout in the classroom and the physical distancing and the barriers and all of that, but they still need to get the kids to and from school. And in the absence of being able to get more school buses, which would be an extreme difficulty at this point, to say the least, not to mention the fact that that would be an additional expense, that does present some concerns. We know that, of course, schools may be encouraging parents to drive their children whenever possible, but that is not always going to be an acceptable solution if parents can't, because again, we may have equity issues in that regard where certain school districts or certain parents have access to be able to transport their children where others may not. And we really do want to level the playing field as much as we can. So transportation is a concern. The guidance talks about asymptomatic, fully vaccinated individuals not needing to quarantine if they're exposed to COVID-19. So to the extent that many of our school teachers who were kind of first in line to get the vaccine have already been vaccinated, if they are asymptomatic and are exposed to someone with COVID-19, they apparently do not need to quarantine at this point. And also individuals who have previously been infected with COVID-19 and have recovered from a laboratory confirmed COVID-19 infection during the past 3 months do not need to quarantine if exposed to COVID-19. And finally, I'll just finish out with a note about community involvement. The guidance document really seems to encourage schools to be communicating with stakeholders as much as possible. Prior to making any change regarding physical distancing, the school must communicate with parents, with teachers, with other staff members, with community members about that change in order to have some dialogue about it. And once a plan is revised in terms of making any changes to the plan that the school had previously put out, that plan needs to be posted online and must be readily accessible for any community member who wants to view the plan. So with that, I will turn it back over to Adam, and thanks to all of you.
Candace, thank you so much. And I know that this guidance has been an issue for a lot of our school district clients. I spoke with one client in particular who over the weekend reviewed the guidance because they were going to a full-time 5-day-a-week schedule on Monday, which had been planned for the past month and a half. And there were several issues that the state's guidance created. Candace touched on one of them, that being the fact that the physical barrier might not be sufficient in classrooms where you have students who are now going to be 3 feet apart, but when they have to eat, the guidance says they have to be 6 feet apart. And if physical barriers don't work according to the guidance, then what is the district to do? So there are these questions that remain unanswered. And like Candace said, hopefully we get some additional guidance from the state or maybe some revised guidance in the near future. So with that, we will turn to our next presenter, Jessica Mahler. Jessica is a partner in our Garden City office. Jessica is an expert on all things COVID paid leave. So what I asked Jessica to do today is to give us really a high-level summary of what COVID leave laws are out there and what you should have your eyes on and keep paying attention to as we go forward and restrictions are relaxed. So Jessica, please take it away.
Thanks, Adam. And you know, we've all been living with a lot of these COVID leave laws that have been enacted over the past year. And, you know, we have a lot of questions. We continue to have a lot of questions, you know, particularly as the world starts to open up again, and we, you know, continue to get more potential requests for the different types of leaves that are potentially available under these different laws. And you know, we are seeing, and I'm getting a lot of different questions about, you know, the extent to which vaccine status or whether an employee has or has not been vaccinated plays into some of these leaves that might be available. And I thought what would be helpful here would really be to sort of get back to the basics, because a lot of the, you know, sort of issues that we've seen come up, you know, with the vaccine, with potential accommodation needs, you know, returning to the office and sort of all of the distancing requirements that come into play, you know, it sort of starts to get our brains thinking, you know, about all the potential complications and nuances of all the different areas. And sometimes we forget some of the sort of basic rules, you know, I'll say in terms of what types of COVID leave may or may not be available. And so I thought it would be useful to sort of go back to the basics to help remind us all about what we're talking about here. So, you know, one of the very, you know, original laws that came out, actually, I think it was the first of the COVID-specific laws that were enacted actually predated the FFCRA that we have all become so familiar with, was the New York State paid COVID leave statute. Now that's separate and apart from what we subsequently, was passed, the New York State paid leave. So I'm talking only about the New York State paid COVID leave legislation that was passed. And we've been living with this for quite a while, although a number of us, fortunately or unfortunately, did not really focus in on what the New York statute provided, because we also were dealing with the FFCRA at the same time. But for many of us, we have not chosen to continue the FFCRA. And so now we really need to focus in on what does or does not the New York paid COVID leave statute provide for. So, of course, the amount of leave that is going to be available under the New York COVID paid leave is going to be dependent on how large of an employer we are. We all know that the benefit or the amount of time that's available under this statute is going to be different for smaller employers, 10 employees or less, with a less than $1 million income. It's going to be a different amount for small or medium-sized employers, being 10 employees or less, but more than $1 million in income, or the medium size with 11 to 99 employees. And of course, the larger size employers of 100 or more employees, and all public sector employers. They're all going to have to provide different levels of benefit, going from 5 days of leave up to a maximum of 2 weeks of leave, depending on where you fit in the in that spectrum. Now, the important thing to remember with the New York paid COVID leave statute is what actually triggers the benefit under this statute. The triggering event here is an order of quarantine that has been issued either by the Department of Health or other authorized governmental agency. So it's the actual quarantine order. It's not the doctor saying, self-isolate or whatnot. It's the actual quarantine order. If we get that quarantine order, then the employee is going to be able to take advantage of the paid time off under the statute if they're not otherwise able to work remotely. So, then we have the situation of employees getting either 5 days of paid leave from the employer, or up to 2 weeks of paid leave. And, we've all been living with this for more than a year now. And so I'm sure, everybody knows sort of where they fit in terms of what leaves they need to provide. The one thing that I will remind the smaller employers is, don't forget that, after you provide that first week of paid leave under the statute, your employees are going to be potentially eligible to get a second week of pay, not directly from you, but through a combination of short-term disability or paid family leave benefits. So that is something that is potentially available for employees there as well. And all of the leave that is provided under the state statute, the New York COVID paid leave statute, of course, is a job protected leave. And we can't charge any of that time against the employee's PTO. There's also the New York section of the New York statute that deals with if the employee, myself, does not have the order of quarantine, but if my minor child gets an order of quarantine and I have to take care of that child while they're quarantined and I'm not otherwise able to work remotely, what kind of leave is going to be available to me in that circumstance? So I don't get my full pay either in a 5-day increment or up to a 2-week increment directly from my employer. But in that circumstance, I may be able to take advantage of paid family leave because the New York statute did also add caring for a minor minor child who's under their own official quarantine order as a qualifying event for PFL benefits. So I might be able to take advantage of, of the leave in that circumstance. Now that's the New York State paid COVID leave statute. There's also, of course, the FFCRA that applies to all of our public sector employers and all private sector employers with fewer than 500 employees. You all know who you are. You've been dealing with these statutes for quite some time. And the issues that have more recently come up are dealing with these tax credit extensions that we've seen. So we all know sort of the classic FFCRA leave that was available and mandated us all to comply with providing this leave. We were mandated to do it up until from April 1st of last year up until the end of December of last year. Since that time, we have not been mandated to offer these benefits, but we could on a voluntary basis. And we're now in the second stage of offering these benefits on a voluntary basis. So, as of April 1st and continuing through September 30th of this year, if we want to continue to offer FFCRA benefits and potentially be able to take that tax credit for those benefits, we can do so. The one thing that we need to be very careful of and mindful of, I will say, is that the extension of benefits as of April 1st of this year, it's a little different than what we had seen previously under the classic FFCRA framework. Now, not only are we dealing with the qualifying events, the sort of original group of qualifying events that we saw, we also have new qualifying events relating to an individual getting the COVID vaccine, recovering from an injury or illness related to getting the COVID vaccine, and either seeking or waiting for the results of a COVID test, either because they themselves have been exposed or because their employer has requested that they get tested. Those are all now going to be qualifying events for FFCRA benefits if we've chosen, again, voluntarily to continue providing those benefits from April 1st of this year through the end of September. The other thing to be very mindful of if we do choose to continue these benefits is the refreshing of the 10 days of available paid sick leave provided under the FFCRA. That refreshed, that's a new bank of 10 days for employees, or I should say up to 10 days for employees, depending on part-time or full-time status. That refreshed as of April 1st. There's also a potential refreshing of the FMLA entitlement of emergency FMLA leave time under the extension. That's going to depend on what leave year you use in your sort of regular FMLA framework. The extension now under the American Rescue Plan, the April 1st through the end of September extension, people may get a refreshed batch of time that they could potentially use for the emergency FMLA under this legislation. The other thing, and I'll say a very important thing to be mindful of, if you do choose to continue providing the FFCRA benefits, is now all of the qualifying events will entitle the individual to take advantage of either the paid sick leave provision, the 10 days there, or the up to 12 weeks of time on the emergency FMLA side. So all of the different events could potentially get an individual benefits under the voluntarily continued FFCRA benefit. The only other thing that I want to touch on is another statute that was passed, not on the federal side, but on the state side. It was the New York State COVID vaccine leave that was passed. That took effect on March 12th, and it continues to be in effect through the end of 2022. So if during that time an employee takes time off from work to get vaccinated, that employee is going to be entitled to up to 4 hours of paid leave per dose of the COVID vaccine. So if the individual is getting vaccinated with either the Pfizer or Moderna vaccine that require 2 doses, they're going to be able to get up to a total of 8 hours paid leave to do that, to get vaccinated on work time. And that time cannot be charged against the individual's PTO. Differently, if the individual is getting the Johnson & Johnson vaccine, which is only a 1 dose, that individual only is going to be able to get up to 4 hours of paid leave. And as we all know, this leave is provided for both public and private sector employees, regardless. And so, we need to be mindful of that, as well as more and more of our staff, presumably are going to be vaccinated. With that, Adam, I will turn it back over to you.
Jessica, thank you so much. That was very helpful. We've been getting quite a few really good questions in the chat. If we have some time at the end, I'll try to work through some of those and answer them. So with that, I don't want to delay anymore. Let's turn it over to our next presenter. Jeff Scheer is a partner in our Syracuse office. Jeff has been following the marijuana legislation very closely and has worked with clients dealing with it. So Jeff, take it away.
Great. Thanks, Adam. It's good to be back on the program. And I've gotten a lot of questions about what I'm going to do once the PPP kind of winds down. And luckily, New York has passed the Marijuana Regulation and Taxation Act, which has given me something to do. Not that I have nothing to do anyways, but it's will fill any void that PPP will leave. So what I want to do today is just give some background on what this does, kind of what we know, what it means, and what we don't know, and kind of where does that leave us going forward. So this is kind of a primer on where we stand right now. So first, the act, which some have called the MRTA, I'm sure we'll come up with a better name. It legalizes the production, distribution, and use of marijuana in New York State. It removes marijuana and marijuana products from New York's Controlled Substances Act and allows the regulation of marijuana under a Bureau of Marijuana Policy. So really, the difference here, and we'll talk about it a little bit, is the fact that marijuana is no longer a controlled substance in New York, yet federally it is still on the controlled substance list. And that's something that we're going to talk about a little bit later. What the act does, it regulates the distribution of marijuana and marijuana products, just the way that alcohol and tobacco are regulated. In fact, there's a Office of Cannabis Management that has been established within the Division of Alcohol Beverage Control. So that's how correlated these are. And it generally expands the existing medical cannabis and hemp programs in New York State. So where do we go with this? So first is there's been an establishment of an Office of Cannabis Management. The powers of this office will be to establish cultivation and processing standards and limitations, licensing all businesses in the production and distributions of product, inspection and enforcement of adult use medical and CBD hemp programs. And what we're really all waiting for right now is this Office of Cannabis Management will issue regulations so we know what the act really means. Because, like all acts, just like we had with the CARES Act before, the statute gives us kind of a basis and a structure for what we're dealing with, but we're really not going to know a lot of detail until we see the regulations. So the first thing to get into is, what is the market going to look like? And I've gotten a lot of calls from clients and businesses who want to enter the market, and they're asking me, what can I do? So first, unlike in the medical marijuana license process that we had back starting in 2014-15, and in that case, the registered organizations were licensed, and there was total vertical integration of the market. So a license entitled someone to be a cultivator, a processor, and a dispenser and a distributor. In this case, their vertical integration is basically prohibited in the recreational marijuana area. So license categories will include cultivation, processing, distribution, retail dispensaries, consumption sites, and delivery. And there's one person can't own licenses in all aspects of that. You will be able to own a license in both cultivation and processing and/or distribution, or you can own a license in retail, but you can't have that vertical integration. So you need to pick and choose what you want to do, and that's really going to be impacted by your access to dollars, your banking relationship, access to credit, tax issues, which again I'll mention a little bit. Those that want to get into the retail business, you're not going to be able to have direct or indirect ownership of more than three retail locations. So that may limit people in terms of thinking they're going to own, right now, someone may own 15 donut shops, and that's how they make a lot of money. In this case, it's going to be a maximum of 3 retail locations. One of the goals of the program, which I think is great, is that there's a goal that 50% of licenses are awarded to those communities that are impacted by cannabis prohibition, minority and women-owned businesses, distressed farmers, service-disabled veterans. I don't expect there to be formal minority and women business-owned certifications to be required, but it will be like a self-certification process through the application. People are asking me what the license fees will be. That's one thing that we just don't know yet. It hasn't been included in the statute. It will be included in the regulations. The differences between the medical marijuana program and this recreational marijuana program. The medical reasons for needing medical marijuana are being expanded. They will include Alzheimer's disease and muscular dystrophy. So, and there'll be some other additions to that. So there'll be an additional reasons for getting access to medical marijuana. There's no longer a restriction from smoking medical marijuana. That's going to be allowed. And medical marijuana, there's currently a 30-day cap on supply. That's going to be doubled. So one of the reasons, there's several reasons we're seeing the medical and recreational marijuana laws pass now. And one of these reasons is additional tax revenue. We see, other than, it's kind of time, and this is where society is going. New York State, in this case, is going to be imposing a 13% tax on retail sales. 4% of that tax goes to localities, 1% to the county, 3% at the local level based on retail sales. And revenue from the tax is going to be split among state lottery fund, drug treatment fund, community grants funds. So, there's a reason why all this is happening. We see a lot of expenses right now on COVID relief and budget constraints. And a 13% tax on all retail sales going back into the community like this and back to the state is going to be a way to fund some of the issues we're going to see at the state level. One of the things you may have heard about is the fact that cities, towns, and villages have an option to opt out from having adult use dispensaries or social consumption sites located in their communities. Any city, town, or village that wants to opt out from these dispensary sites and consumption sites have to do so by December 31, 2021. Of course, a local law can't be overturned by a local referendum, but it's going to be interesting to see which communities opt out of having dispensaries and social consumption sites, which communities allow for it. And remember, there's an offset. So communities that opt out won't benefit from the tax that's collected on the retail sale of the product. One of the questions that we get a lot is, how does this impact individuals? And I think we're seeing that a lot. So first is that people with certain marijuana-related convictions for activity that's no longer deemed criminal are going to have their records automatically expunged. So that's great for people that have had, convictions on possession, let's say, for anything under 3 ounces. Those records are going to be expunged. So that begs the question of what's no longer criminal. So individuals can now possess up to 3 ounces of cannabis for recreational use. Individuals 21 or older can smoke, ingest, or consume cannabis, but not in schools, workplaces, or inside a car. So, I think those people that are using it just need to be careful about where they're doing it and not doing it in schools, workplaces, or inside a car, or any other place where an organization may prohibit the smoking, ingesting, or consuming cannabis. I think we're hearing, some college campuses are going to limit it on their campuses. One of the questions we're getting is, what can I do at home? And I just want to note before I mention this, there will be allowances for what you can do at home, but none of this is allowed until 18 months after the first adult use dispensary opens. So we're talking like 2023, when you will be able to store up to 5 pounds of cannabis at your home, so long as it's properly secured. And in 2020, and this is just a guesstimate on the date, you will be able to grow up to 6 plants per person at home, up to a maximum of 12 plants per household. So yes, there are allowances for having cannabis at home, storing it at home, having plants at home, but we are a long way off from that happening. So if you were planning on starting your garden, in the spring, and who wouldn't want to start a garden right now, and you are planning on growing some cannabis, I suggest you hold off until you're allowed to do so, sometime 18 months after the first dispensary opens. One of the things I wanted to mention is there's still disparities between state and federal law. I mentioned the Controlled Substances Act. Marijuana is still on the controlled substances for federal law, still illegal. I think the enforcement of some rules have been relaxed, but it is still illegal. There are significant tax treatment differences of income and expenses between state and federal law. On a federal level, there are issues with Section 280E of the Internal Revenue Code, which allows deductions for costs of goods sold. And actually, you can't deduct for costs of goods sold expenses incurred in retail sale of marijuana. So that's going to impact where you want to fit what license you want to obtain. Another issue that's come up in difference between state and federal law is banking. A lot of national banks won't touch businesses that are involved in cannabis because it is illegal. A lot of state chartered banks, credit unions may go into the cannabis business. So that begs the question of, hey, I'm interested. I want to get in the business. What do I do now? So what I've told a lot of people is, if they are interested, talk to your lawyer, your accountant, your bank, talk to some people who may have access to dollars, maybe talk to your insurance agent, kind of start setting your wheels in motion so that when we get the application to go live on this, when we get the application for licenses, you're ready to go. You have your banking relationship established. You've talked to your accountant about the most advantageous way to structure your business and which licenses you should obtain for purposes of structuring your business. But as of right now, I wouldn't go and form an entity and do anything too far along until we see the additional regulations. So that's my high-level review of the current Marijuana Act. And good luck to everybody who wants to get into the business.
And Jeff, you are going to be putting out some information memos on these issues, right?
Yes. So probably later today, everyone will see pretty high-level information memo on the issue, and then we will be over the next probably 4 or 5 weeks having some information memos, kind of getting into a bit more detail on what I talked about today and what we learned through the issuance of additional regulations.
Awesome. Well, thank you, Jeff. And just for everybody out there, we're getting a lot of really good questions in the chat, trying to go through and answer them in the chat. I don't know if we're going to have time to get to them at the end of this, but we do appreciate the questions, and we're going to answer as many as we can. So with that, we're going to turn to Katie Anderson for her weekly update from Albany. I know a lot has happened in the last week, and I think we could say that pretty much every week. But Katie, the floor is yours.
That's right. We can say it pretty much every week. And today I'm mostly going to be focusing on some more breaking news issues. So first, looking at reported cases, we're happy to see that cases are decreasing. That is excellent news, but cases still remain very high, as Candace alluded to in her presentation as well. You look at where we're at, and we're still at the levels that we were at around Thanksgiving, which were very high. So COVID is still spreading out there. It's still a risk, and the variants are extremely contagious. The variants are making up about 70%, if not more, of cases in New York State, and they are all very contagious. They make mask wearing, even more important. The good news as well, though, is about vaccinations. 25% of New Yorkers are fully vaccinated. 39% of New Yorkers have received their first shot. Now, this chart, again, I show it to you every week. Last week, it said that by June 15th, we would be at 70% of people would have received their first shot. This week, it says June 10th. There is, however, a complication that has arisen. The Johnson & Johnson vaccine suspension. So I dug deep into this today. And as you all know, I'm an attorney, not an epidemiologist. I'm not that doctor. But digging into this, the FDA and the CDC have paused use of the Johnson & Johnson vaccine at federal sites. New York has halted its use at state sites. If you have an appointment scheduled at a state site, you can go there and you will likely receive Pfizer. They are encouraging you to continue to go to your state sites. Pharmacies are canceling its use. Counties are canceling the use of Johnson & Johnson just for a little bit. Why? 6 women between the ages of 18 to 48 have developed blood clots within 2 weeks of vaccination. So there have been 6.8 million Americans who have received the Johnson & Johnson vaccine. This blood clot development is obviously not typical, but the blood clot itself is not your typical blood clot. You can't treat it with your typical blood clotting medicine. But it is important to note here, blood clotting, while severe, and it's very unfortunate that this has happened. One of the women has died. Another woman is in serious condition. This is a common side effect from medication. Birth control, for example. 1 out of 1,000 women on birth control will develop a blood clot. That is, it's just important to look at that and take this into context. As a result, we are concerned that you're going to see vaccine hesitancy surrounding Johnson & Johnson. The CDC and the FDA are going to be studying this over the next, hopefully they're convening an emergency meeting today. I believe that's occurring right now about this. But in unrelated news, the Johnson & Johnson supply was already diminished in the United States because there was contamination at their Baltimore plant. This contamination that occurred at the end of March contaminated about 13 to 15 million doses. So while that was unfortunate news then, maybe it was good news now. But it's important to look at what happened in Europe with the AstraZeneca vaccine. These 2 vaccines are very similar in how they are used. They both use adenovirus as their vaccine platform. Again, not an epidemiologist. This is different from Pfizer and Moderna's use of mRNA technology. As of now, Pfizer and Moderna's vaccines have not had these side effects. But with the AstraZeneca vaccine, remember, Europe certain parts did stop issuing it for a little bit. In rare cases, people's antibodies were activated, and it activated their own blood platelets, causing blood clots. So out of the 34 million vaccines in Europe that have been administered with AstraZeneca, 222 people developed blood clots. These numbers appear consistent with each other, but and again, it's mostly women, and it was mostly women under the age of 60. So what did the European regulators do? They didn't stop the use of AstraZeneca, but they, because the benefit of the vaccine outweighed the risk, they have been limiting the use of the AstraZeneca vaccine to older people. There is a good chance that we will see that same thing happen with Johnson & Johnson. Anybody below the age of 60, for example, may be encouraged not to receive the vaccine. They may even be looking at gender. Again, we haven't been looking enough into the side effects from the vaccine. And specifically, we haven't been looking into the side effects of the vaccine as it applies to women. There are many studies that look at the side effects that apply to men, same thing with almost every other thing in the medical field, but not to women. So this is going to be a rapidly developing thing. As you know, we'll keep on top of it, but know that the vaccines could be interrupted for the foreseeable future. Looking at the vaccine passport. Now, I've gotten quite a few questions about this, and this will come up with my last point. You can sign up to receive this vaccine passport on New York's website. That's where you go to receive it. What it does is everybody who receives the vaccine gets their vaccine card. When you are fully vaccinated, you can go on here and get that card basically on your phone. Why does that matter? Because in order to go into certain venues, you are going to need to show proof of vaccination. So this is the graduation and prom guidance that emerged this week, yesterday, about how graduations and proms will be held. If you look at this, it is similar, very similar to the event guidance that's out there. So in order to go to a Mets game, I would need to either show that I am tested or that I have proof of being fully vaccinated. Same thing with prom and graduation. If you are having a large scale outdoor graduation, you can have over 500 people so long as your venue has over 2,500 plus in capacity. But every person attending that graduation, every person who is a student, everybody has to be either fully vaccinated or have a negative test. That pass that I had on the last slide will show if you've been fully vaccinated or if you've received a negative test within the period of time that you need for these events. So either 6 hours before with a rapid test or within the past 72 hours for a regular test. That is my whirlwind brief update from Albany. I'm going to kick it to Adam because he's got the travel advisory stuff. And I got to say, I was so thrilled to not have to do the travel advisory this week.
Katie, thank you. Always great. And yes, I got the travel advisory issues this week. So actually, Kathy, can you skip to the next slide? So there were, one of the things we like to do in this webinar is make sure we let you know when guidance changes. That's quite often because guidance changes quite often. And I wanted to highlight a couple of areas where we received some new guidance over the past couple of weeks. So first of all, quarantine requirements for people who have been exposed to someone who's positive with COVID-19. I've linked to the guidance here in the PowerPoint presentation, and you'll be able to get that if you get the slides. So on April 1st, we got revised guidance from the New York State Department of Health on quarantine requirements for individuals exposed to COVID-19. There are two important points I want to hit on. First, this guidance confirmed that there's no quarantine required following exposure to someone with COVID-19 if you are fully vaccinated and you are asymptomatic. So fully vaccinated, by way of review, is your 2 weeks past the last dose in your series if you're taking a 2-dose vaccine, or if you're taking the Johnson & Johnson, two weeks after that first dose. This is the same as the prior guidance with one exception. If you recall, the older guidance, I think it was from March 10th, said that you also had to be within 90 days of getting that second dose. This new guidance we got in April removed that 90-day limitation. That's important. Because I know a lot of people were wondering, well, I got fully vaccinated back in January, so does that mean that these quarantine requirements are going to expire for me in 3 months? The state clarified that no, that's not the case anymore. Next slide, please. So this guidance also confirms that there's no quarantine requirement following exposure if you have had COVID in the last 90 days, you were diagnosed with laboratory confirmed COVID, you've recovered, and you're asymptomatic. So this is similar to the old guidance, but I wanted to highlight it as well. Next slide, please. All right, so the other guidance that just came out over the weekend that I wanted to talk about is the travel quarantine guidance that the state put out to update its April 1st guidance. So this is a rapidly evolving guidance document. And again, I've linked to the most recent travel guidance document that'll be available in the slides, and a couple of important points. So it's very clear now that there is no quarantine, work furlough, or testing requirement for asymptomatic domestic travelers, with just a couple of exceptions, or actually really one exception. And that is for unvaccinated healthcare personnel who haven't recovered from COVID in the past 3 months and who work in these specific areas: nursing homes, assisted living facilities, and enhanced assisted living facilities. The travel guidance still recommends testing following domestic travel for unvaccinated individuals, but it does not require it. Next slide, please. Here was where the big change occurred in this new April 10th guidance document, and it deals with international travel. So the state is now adopting the CDC's recommendation that no quarantine be required or work furlough or testing for asymptomatic international travelers. New York again has an exception for healthcare providers, both healthcare providers who work in nursing homes, assisted living facilities, but also other healthcare providers as well. Again, the guidance includes a recommendation for testing for international travelers, but not a requirement. And then, like the old guidance, it includes this exception for individuals who are traveling to and from Canada across a land border. So that is a whirlwind update on the new guidance for travel and for close contact. Again, it will be available in the presentation, in the PowerPoint presentation, which you all can access. So with that, thank you so much for attending. We appreciate your continued participation in these webinars, and please feel free to let us know if there are additional topics that you'd like us to cover. Thank you all. Have a great day.